Wow, that was amazing. As the comments in the chat rightly state, all the speakers were perfectly selected for this session. Politics informs decisions, and data and research can both influence change and drive at both the community and policy level. And I think that's been demonstrated in each of the conversations. So having watched all the videos, we can start with the question and answer session. And I've already noted a few questions in the chat, so we can jump right in. So we have a question that can be addressed to Mr. Michelo and potentially also Ms. Nelima. How can Africa as a continent be prepared to fully participate in combating this and future pandemics, like making and distributing vaccines? And if you don't mind, please come back on video as you respond.
We can pool resources, both human capital and infrastructure. I think that from the production of the vaccine itself and the development of candidate vaccines, that probably is the way we can be able to start. I think in terms of human capacity, we already, I think, have some level of human capital which can be able to begin participating from the development side of things. I would end there.
Great, thank you so much. And Ms. Nelima?
Yeah, thanks. Can you hear me?
Yes.
Okay. So my one answer to that is that one of the things that happened during the pandemic is that some of the efforts that we've been making towards strengthening our health systems and in public health were taken back like a year back, 2 years back during the pandemic. So I'd say one of the ways in which we can be better prepared for the next pandemic is ensuring that the current health systems are as strong as they can possibly be. So whatever it is we have in the different health areas, that we should focus on continuously strengthening, continuously monitoring, so that at any one point, if something new comes in, then we already have robust systems as we figure out the new problem. Thanks.
Thank you. And a question for you, Ms. Fatima Hassan. How can we influence intellectual property laws to our benefit while also promoting our research?
Yeah, thanks. That's a great question. I think the first issue is we have to recognize that the research has to be well-funded, supported. There needs to be significant investment from African governments as well. And I think we need to call out the issue of why we were so unprepared, where African governments are actually spending their resources. Why is it that we, having to import 99% of all of our vaccines across the continent from countries outside of Africa, right? So we have a issue around health governance, we have corruption, we have civil conflicts in many parts of Africa. So I think there's a bigger question we have to ask about how does all of that interact with an intellectual property or global trade regime, which many of our countries have been forced into. How do we reform that? Unfortunately, we thought that would happen in the last year at the WTO in Geneva. And what we've seen has been a significant blocking of what the South African and Indian government had actually asked for, which was a temporary relaxation of intellectual property rules, including patents, for the duration of this pandemic. So I believe that what we were promised is not what we're getting. We were offered solidarity and sharing of information and knowledge. We're getting the total opposite. So the battle, I think, in the next 5 years, or to prepare for the next pandemic, or to share all of the knowledge on critical COVID-19 technologies is even greater now. And people can say that IP is a side issue and that patents are not really the problem, but they're a significant part of the problem because the vested interest from richer governments, including the G7 member states and pharmaceutical companies, to block this one narrow waiver just for this pandemic has actually been remarkable. The last time we saw this kind of lobbying and active vested interest colluding in this particular way was during the HIV/AIDS crisis, and we thought that we wouldn't see this again. And I remember being an HIV activist during that time. And what happened to Africa? We had to wait 10 years. We waited years and years while people that we loved and cared for, our colleagues, our communities, people in our family just died. And they died while people in the richer parts of the world were getting ARVs and they were getting affordable access to it. And so we can't have a situation like that with vaccines. I think the Africa CDC has indicated that the current vaccine coverage in Africa is less than 3%. Compared to 55% in richer parts of the world, that all of the vaccine doses, wherever they've been made, whoever's made them, has actually gone to the richer parts of the world. So we have a real crisis on our hand, and I think that IP is a critical part of trying to address that inequity. Of course, in addition to that is what Michelo and Nelima have talked about in terms of vaccine hesitancy and a range of other issues, but we're not going to be able to address those issues if we can't get vaccines to people who need it the most. Thanks.
There's so many comments just to your response is just speaking to the externalities and how to protect the continent from these externalities to gain independence both financially and geopolitically to some extent during the wake of some of these pandemics. A question to the entire panel is how can we better utilize the media to articulate facts and not spread fear, both formally and informally? Perhaps we can start with you, Ms. Fatima Hassan.
So, again, another great question. I'm not sure if you're seeing this in your part of where you are, but what we're seeing is great vaccine hesitancy, and we're seeing a lot of disinformation. And again, the last time we saw these levels of disinformation and non-belief in science and data and facts was during the HIV/AIDS crisis. Many of us had to fight a lot of what we call disinformation or quackery, where people were told that garlic and beetroot would cure you of HIV/AIDS, and it didn't, and we lost people needlessly. There was so much premature death and suffering. And what we're now seeing is something very similar to that, where people are being told, don't take the vaccines. You can use some kind of concoction of pepper or liquids to basically prevent you from getting COVID. And so the media has a critical role to play in not having all sides of a debate, because the science is clear, the data is clear, the facts are there. The vaccines have been approved by reputable global bodies, including the WHO. Scientists, including scientists from Africa, have been part of this clinical research and clinical trials. The vaccines are considered safe and effective. The ones that are approved for use in your country should be used. And the media should be playing a very important public announcement role, where information needs to be shared on an almost regular basis to cut through the myths, to cut through the disinformation, and to tell people of the true scale of death and illness. I mean, Africa has now reached, one of the highest case rate for COVID across the world. And we're going to see more suffering and death unless we can get key messages. And I think some of the messages Nelima and Michelo and also the last speaker had talked about. How do we simplify the information of what's happened in the last year to try and convince as many communities as possible to get the vaccine where there are supplies, and not to believe a lot of the disinformation and what we call misinformation in relation to this pandemic.
The best way would be for healthcare providers or researchers to be to be present and be able to communicate on social media. I think we need also to look into an option of having like health or science journalists, which then can constantly be putting information from certain official portals. So, for example, through the Africa CDC, in Zambia here, we have the Zambia National Public Health Institute. And so such an organization or institute should be able to be putting out information regularly for people to be able to know what is happening And as long as that form of communication is constant and regular and doesn't wait for, say, people to question or is not reactionary, I challenges.
Thank you so much. Ms. Nelima, have you managed to unmute?
Yeah. Yeah. Can you hear me? Can you hear me? Yeah. So one of the ways I think media and social media can be used as a way of getting proper information to the masses is getting buy-in. One of the things that happened during the pandemic is that information from the official sources were taken with a pinch of salt, while the other information from various quarters was more trusted information. And that pointed to a bigger issue of the masses not trusting the authorities that be, whether it is the WHO, whether it is the CDC, the presidents, the governments. There was a lot of mistrust. So there was a lot of, they're coming to get us. And so that felt like one of those things where there's a need of understanding, having a very deep understanding of how communities work, how communities operate, so that whenever information is given out, it's not given from the top, trickling down to the masses, but it's more of almost like a level playing field where all the players are coming together, listening to each other, listening to perspectives, and even listening to, like, you may have the facts, but listen to the fears, to the concerns that are actually driving the misinformation, and then use that to actually find a way to disseminate that information to the rest.
Thank you so much. I'm aware that we are really over time. I want to thank this panel of speakers and the audience for being incredibly participatory. I'd like to now hand over to you, Efua,